Hello, Tulare County. This is Tammy Weicker-Adkins, Public Information Officer for Tulare County Health and Human Services Agency. And today I'm talking a little bit about our access and functional needs population. And those are individuals who are medically vulnerable because of a type of illness or condition that they might have. So we're going to talk a little bit about individual and caregiver prevention measures. And these can be found on the CDPH and CDC websites. Both of them have great tips for these individuals. Of course, we are always talking about using respiratory and cough etiquette, coughing into the crook of your arm or using a disposable tissue and then washing your hands right after, staying home when you are ill, and seeking immediate medical care if symptoms become severe. One of the things that we like to talk about is making sure that you have maintenance of your durable medical equipment. And that is making sure to clean your medical supplies and equipment frequently and in accordance with the product manufacturer guidance. And then routine cleaning of high-touch surfaces. So just like the table that I have here, doorknobs, light switches, handles, desks, toilets, faucets, and sinks. Those are some of the things that you can do to make sure that individuals are safe and remain healthy. If you're looking for cleaning products that are kind of rated, you can go on the CDC's website and look at environmental cleaning and disinfection recommendations right on their website. Make sure that you have access to the following entities: any 24/7 health care lines provided by your health providers and health plans, specialty health care providers if you need them, community-based organizations, transportation providers, health plans, care coordinators, nurse hotlines, telehealth services, and other services that you need for your assistance. And make sure that you have necessary food and supplies delivery. Develop plans with service providers who make regular home visits to minimize exposure, such as personal assistant, attendant services, home health, hospice, and independent living counselors. Consider the use of phone check-ins, video chat check-ins, or use of neighbors for your health and safety checks so that you minimize your exposure. And understand the emergency plan of facilities that you visit on a daily or regular basis, such as dialysis centers, blood treatment centers, or chemo and other infusion therapy sites. Now, this is a little bit more for individuals and caregivers with staff. So of course, you want to make sure that employees with a fever should not be at work. And employees who are ill should be excluded from work for at least 24 hours after a fever is resolved, and following federal Centers for Disease Control and Prevention and/or local health department guidelines for returning to work. Recommend excluding employees, students, and volunteers who are not critical at this time to providing care from working in areas experiencing more cases of COVID-19. And to prevent the spread of respiratory germs within facilities, it is recommended that clients and employees become informed, and the people to inform them are those folks that are running the facility. Describe what actions the facility is taking to protect them, including answering their questions and explaining what they can do to protect themselves and their fellow residents. This step will really help to decrease the anxiety and stress they may feel from the unknown. Designate a time to meet with your staff to educate them on COVID-19 and what they may need to do to prepare. And the following may be useful resources, and these are all on the CDC's website: how COVID-19 spreads, clinical management of COVID-19 patient, and infection prevention and control recommendations for COVID-19. And those addresses will be up on our screen. And lastly, minimize congregate living activities and outside programming. Although this may be a tough one to get around, please try to ensure that residents are eating their meals in their rooms instead of in congregate settings if there is not enough room for applicable social distancing. And minimize the number of congregate activities, especially if your county has community transmission cases. We hope that this is helpful, and this is guidance provided by the CDPH and CDC. Thank you, Tulare County.